Despite the exciting research progress being made, a recent study found that Black women receive PI3 kinase targeted therapies at a lower rate than white women, although both of these groups have similar rates of mutations. We asked Dr. Javeri if she could shed some light on why we are seeing this disparity.
We know that, even when it comes to testing, we've seen due to structural barriers, there might be fewer Black women who might be offered testing or have the availability of tumor or blood testing for PI3K mutations. So if you don't find the mutation, how can you offer them PI3K inhibitors, given that these inhibitors are approved only if the tumor harbors this mutation? Second, we know that there has been an underrepresentation of Black women and women in minority in clinical trials. And this is why we have less efficacy and safety data, and therefore an even slower adoption of newer treatments that get approved for these minority patients. In addition to all of that, there are certainly socioeconomic barriers. There are issues related to insurance coverage. There are issues related to geographic access to, say, academic sites where you could, enroll or get access to these drugs, or cost issues that could really play an important role and come in the way of why these women are not able to get access to these PI3K inhibitors. And last but not the least, I think we cannot forget that biologically, these women are different or their tumors behave differently because Black women in general, we think, have a higher prevalence of presenting with, say, triple negative breast cancer, which is thought to be way more aggressive. And currently, the PI3K inhibitors are really offered for hormone receptor positive breast cancer and not necessarily PI3K. Inhibitors are approved for triple negative breast cancer. And so this is why that could be a potential reason as well as to why we're seeing a slower adoption or a less representation for access or adoption of PI3K inhibitors for Black women.
To learn more about how Komen is working to close the gap in disparities between Black and white women, check out our recent report linked below.